Welcome to the Vanderbilt Hospice and Palliative Medicine program. While I am so excited that you are interested in Vanderbilt as a program of choice, I am equally energized to know that people who are as talented, as motivated, and as compassionate as you are actually interested in palliative care as a field overall. I can say with complete conviction that we have an amazing training program to offer you all. I guess I could sound like I'm biased. However, I thought it might be a good idea to maybe invite some of my colleagues, some of our interprofessional team members, as well as our fellows, past and current, to maybe go over the top 5 reasons why we think Vanderbilt is such a fantastic training ground for you. First and foremost, Vanderbilt has an excellent, world-renowned reputation for clinical and academic excellence embedded in rigor and clinical curiosity. Along with teaching you the basics of palliative care and equipping you with a skill set to be a consummate professional, we also, like a work family, like to get to know you a little bit better and to really incorporate you into the fun and the kind of lovely times that we have with our patients, with each other, and in training you.
Vanderbilt is fantastic.
I love working here at the VA.
The number one thing that drew me to Vanderbilt was the dedication to education.
I think that the best thing about working at Vanderbilt is the environment of collegiality.
The beauty of Vanderbilt in general is the outstanding quality of people that work here, especially highlighted in our palliative care group.
The people are incredibly kind and curious.
The people that we work with are lovely. The patients and their families appreciate our help.
I have been lucky enough to be involved in a number of training programs across the country, and I have to say that Vanderbilt is really unique in terms of how much time and effort and really mindful and detail-oriented work goes into the fellows' education.
Here, you will be part of the larger VUMC enterprise and hospital system. We established the clinical programs at both Vanderbilt and the VA in 2008 and have seen a tremendous growth in our interdisciplinary teams and expansions across both campuses, whether it be inpatient clinics or consult services.
It is fun to work at a place where you feel supported and people care about what you do, not just within your department, but all across leadership.
They really support the education mission, support us with faculty development to help make sure we're maximizing the training experience.
The camaraderie, the ability to care for patients together where we get to do the right thing and learn alongside one another, to me is, I think, one of the greatest pleasures in working at Vanderbilt.
That is what keeps me coming back here well past the fellowship program here and doing all that I do on a regular basis.
We also pay a lot of attention to ensure that you have an excellent training ground with our interprofessional team, which is made up of social workers, case managers, psychologists, pharmacists, and chaplains. And you will find that they are your biggest cheerleaders, your biggest mentors as you navigate family meetings, as you have one-on-one conferences in the hallway. And this, I feel, really adds a huge dimension to our training program.
We have a culture where you feel like you're safe, where you get to be able to be yourself, and especially as a learner, to know that you're going to have the opportunity to practice and to grow while someone has your back. It's never about being pushed in an uncomfortable way. It's about being given the chance to grow in your own way.
I've really enjoyed my time at Vanderbilt so far because the attendings are really great and they spend a lot of one-on-one time teaching us.
And it's not just in terms of making sure you get the foundations and the basics of palliative care, but the specialized palliative care for really ill patients, and learning how to teach other members of a care team, learning how to work really well with your interdisciplinary colleagues, how to be a good consultant and consult etiquette, how to transition patients across levels of care.
We also work really closely with our interdisciplinary team, and they're very involved and engaged.
I think one of the unique things about our program and having that VA site for training is that the VA has mandated palliative and hospice care for all veterans. So all VA hospitals in the United States have a palliative care program. What that means is you get to work with a fully staffed interdisciplinary team, including a chaplain, a social worker, and a psychologist.
I'm one of the chaplains here at Tennessee Valley Healthcare System and have been part of the palliative care team from its very inception. I am part of the morning huddles, and I often have a chaplain resident with me, learning with everybody else how to be part of a palliative care team.
There's a real interest in how we can work together to solve problems for patients. It's something that I think is very unique about Vanderbilt.
Our fellows have in particular commented on how they've enjoyed working with our psychologist, going into rooms with him and seeing how he works with patients and how that works in the palliative care world.
One of my favorite parts about this fellowship is that twice a month we do debriefing with a clinical psychologist, Dan Kern, and the other fellows.
The debriefing group really is a safe, supportive environment where the fellows can talk about anything they'd like to talk about. This might involve stressors associated with fellowship training or the rigors of working with patients with chronic illness at the end of life.
No one person can be in charge of everything. We know that we're going to rely on the people that work with us and work around us to make sure that when patients are in our hands, that we do the best job for them, and make sure that when we talk about the beauty of palliative care being an interdisciplinary team, that we live up to that.
I felt like everyone was pulling in one direction, and that direction was to provide excellent care for patients, but to also make you an excellent doctor when you are done with the program.
I feel like I'm particularly privileged to work with our interdisciplinary team that's really integrated into our palliative care team.
And that feeling of interdisciplinarity and comradeship has really allowed me to both practice in two specialties and to do research at the intersection of those two specialties.
And that really our multidisciplinary team is actually that, and it's a nice balance of what each of us brings to the table to try to really take great care of the veterans we serve, and they're such a unique and interesting population, and it's a joy and a privilege to do that.
Vanderbilt is a very large hospital enterprise, and we are privileged to be able to offer multiple training sites with an incredible diversity of patients, whether it be the inpatient palliative care unit, whether it be the busy and very diverse consult services across both the VA and Vanderbilt, or whether it be both the not-for-profit and for-profit hospice settings that we are able to accommodate. We also have an incredible array of nursing homes, which are all staffed by our own Vanderbilt Hospital medical directors and nursing home medical directors.
The thing that distinguishes our program is it allows you to get to see a whole lot of patients in that 1 year you have for fellowship, so when you come out, you're prepared to see almost anything and care for almost anything.
I think I learned some of my most valuable experiences through the Vanderbilt PCU.
So when you are rotating in the palliative care unit or on the consult service at the VA or Vanderbilt, you're set with a certain attending, which really makes for kind of an apprenticeship type experience. You're seeing patients with the attending or seeing patients on your own and then following up with the attending, which just adds to your training and education.
I felt like the fellowship, because it provided me with such a diversity of training with so many different cases presented in different locations, the palliative care unit, our outpatient clinics, our electives, our pediatric rotation. I feel like all those experiences provided a strong foundation for me to continue to build.
Like any major academic enterprise, Vanderbilt believes in the 3 pillars of clinical medicine, education, as well as research and quality improvement. Our faculty in our section of palliative care has done an incredible job over the past few years in really catapulting our program into the national platform. We have had a number of publications and currently have a number of exciting projects that showcase our faculty and interprofessional team members' various interests, not just in palliative care, but across the whole Vanderbilt enterprise, as well as in collaboration with multiple sites across the country.
We have had the opportunity, as part of a large institution like Vanderbilt, to collaborate with other researchers across the institution. We have a group here called Victor, which is focusing on translational research. We published earlier this year a trial called Compass in the Journal of Pain and Symptom Management, looking at early palliative care in the end-stage liver disease population. And we are now working on the follow-up study to that called Sequel, which will be looking at the same question but using a different approach. We have a wealth of patients, a cadre of clinicians, and I think now the ability to do some really exciting research so we can share some of the work we're doing to create best practices across the country.
And I study the role of specialist palliative care in surgical care of patients. Specifically, I try to identify what surgical populations would benefit from specialist palliative care and find ways to deliver palliative care to these patients. We have a wonderful clinical palliative care program and a tremendous research infrastructure that allows me to bring those things together.
Our fellows are our legacy. We take incredible care in getting to know them and to create a personalized learning plan for each one of them based on their past experiences. We have surgeons who've come to us, we've had neurologists who've come to us, we've had family practice, DOs. So it is important to personalize it. It is really an honor for us to be able to shape them and to see them become consummate professionals and leaders wherever they choose to practice. It really is probably one of the best parts of our job as faculty and program leadership of the fellowship program.
We have so much heart and really have built a community. We say it time and time again, but we really are like a family.
One of the best things that I like about working at Vanderbilt and the palliative care team is really the close-knit community that we have, particularly at the VA, but it's the same at Vanderbilt as well. Our team truly feels like family, and I think it just speaks to how much all of the attendings care about us.
We don't hesitate to celebrate birthdays and holidays, and we have a little more time to kind of have some more fun. Maybe I shouldn't say that out loud.
I felt comfortable there. I felt like the faculty, the staff, the coordinators, all the people in the program were working together to make sure you received the best education. It felt like a safe environment where you could make mistakes and learn from them.
I've really found at Vanderbilt that the palliative care group, in addition to the Department of Medicine as a whole and the Department of Surgery, have been very open to someone who's not an internist doing the palliative medicine fellowship. And that's why I have stayed at Vanderbilt, and that's part of the reason why I trained at Vanderbilt. During the fellowship, I was able to learn from internists and one of my co-fellows who was an oncologist, and even offer my own viewpoints as someone who is trained in surgery. I think that's something that's very special about the Vanderbilt program. We bring together palliative care providers from a number of home disciplines, really to create an environment where people can feel at home no matter what their initial residency training was.
I feel like the faculty was very engaged. I felt like they loved to teach. I felt like they didn't begrudge the time out for education, that I was more than just a body there to work, that they love to impart knowledge, they love to receive knowledge.
Also included the opportunity to be a chief resident, which was super important to me because education is one of the key aspects of being a physician. To be able to engage people at the very beginnings of their career in medical school, all the way through the fellowship program now. And to realize that as a fellow, a huge part of what I loved so much was being that junior faculty member, to feel like I'm becoming the expert, to know that you will have the opportunity to lead that next generation of learners, not just in palliative care, but in a way that will help every specialty. Going through this fellowship will give you the opportunity to be an ambassador for this entire specialty, no matter where you go. It's a pretty powerful feeling.
In summary, palliative care is a young, growing, and exciting field that spans many specialties and many disciplines. And it really is our privilege to train applicants such as you. We enjoy training our fellows, and we absolutely love to see them go out into the world and do amazing things that impact the communities that they practice in. I personally, along with our faculty and our interprofessional team members, would love to have you come and take a look and visit us at Vanderbilt over the next few days, weeks, or months. And good luck as you explore this field. Thank you.